Hey everyone, Alexa here from NP2Go, one of the nurse practitioners. As you noticed in one of our previous videos, talked about hormones, and it really sparked some conversation with women, which is exactly what we want. It is not normal to feel like all of a sudden nothing is going right. Now I'm seeing belly fat arise. I'm seeing the decrease in ability to lose weight. I'm seeing mood changes, hot flashes, sleep disturbances, brain fog, irritability with loved ones. That is all signs of hormones kind of changing in the body. So naturally, your body starts to decrease a little bit, maybe more with progesterone starting off in your 30s. You tend to see testosterone decrease in your 40s, and then the estrogen hits with a decrease in the 50s. And that's when you really see the heavy side effects of the perimenopausal symptoms. However, those symptoms can be hormonal related starting in your 30s. And all of the ones that I've listed earlier are all to do with hormones, and actually replacing hormones can fix a lot of those issues. But a lot of what women don't know is that it can also prevent a lot of things from happening moving forward in life. So if you start early enough, once you're starting to see those symptoms start, which can be in your 30s, you can start as easily as doing a testosterone replacement. Most women don't need that estrogen until they get a little bit older. Testosterone replacement, even utilizing progesterone. Really in every aspect of the lifespan of a woman. Really not a bad time to add progesterone to treat symptoms. So sleep disturbances, progesterone's great. It can actually be utilized in many ways synergistically with estrogen. So the benefits of estrogen can be essentially multiplied because we are also utilizing progesterone. Some of those benefits are decreasing your risk of heart attack and stroke, decreasing belly fat, decreasing the brain fog and difficulty thinking through kind of just daily thoughts, decrease your risk of Alzheimer's, decrease risk of bone fractures, osteoporosis. All of those things are from utilizing hormones, and we can help you do that. So when you see specifically a decrease in testosterone, that's where the low libido comes in. That's where the low energy comes in. When you see even the hot flashes can really start when you're in your 30s. And those are those symptoms that I'm talking about. Doesn't mean you're in perimenopause. Now, perimenopausal is that transition period that can last anywhere from 6 to 10 years and kind of depends on multiple factors. A lot of the times perimenopausal will start to hit younger when maybe your mom went through menopause at a younger age. Also outside factors, environmental factors, foods that we eat with a lot of preservatives can also add to early menopausal symptoms. And going through menopause, you've actually reached menopause when you haven't had a period for a year. And when they start to see the estrogen decrease, okay, we see the estrogen decrease and you're not having a period, you're in menopause. But a lot of what people hear at the doctor is, well, your hormones are fine, it's fine, they're all within normal range. Well, as I've mentioned on previous videos, normal range doesn't mean optimal for you. And just because it's within that normal range, that is shown typically on a bell curve. 90% of the population falls within that reference range on when you see your labs getting drawn. But just because you are within that reference range, it can still be so off for personally your body. And it also depends on where you are in your cycle. Your progesterone levels are honestly not really checked because they can be different from day to day depending on where you are in your cycle. Really, testosterone and estrogen are the ones that we check for most, and thyroid. So sex hormone as well as thyroid receptors are all over the body. They are actually on every cell in your entire body, meaning every system is affected by hormones. Okay, so that is something that we can help utilize by getting labs drawn and really going over what we're experiencing in life and side effects and symptoms that we're seeing. That's where we really know that we've hit a good level when our symptoms have been controlled. We're not seeing those hot flashes. We're not seeing the belly fat. We're not seeing the brain fog, the irritability, the low libido, all of those things. We've had many women come in and say, oh my gosh, my marriage is so much better now that I'm on hormones. And actually, being on hormones for an extended period of time, at least 5 years, research shows you to get the protective qualities of hormones on osteoporosis and heart health, atherosclerosis, which is essentially the plaque buildup in your vessels to lead to cardiac risk and stroke. All of that is decreased when you utilize your hormones and you get your levels to an effective level for you. So that is the good thing. And I do like to point out, women can start seeing these symptoms after a partial hysterectomy, even though you still have your ovaries. I have a lot of women coming in here, oh, well, I got my uterus out, I still have my ovaries, but ever since then, is where my weight gain started. It's where my energy levels changed. It's where my husband said, oh my gosh, please do something. So I just want to say that there is a fix, and just kind of go over women's health in general, how important it is to discuss and to communicate with other women, because ultimately we need to have each other's backs. This is not the easiest thing. And if we can manage feeling better, and women have come a long ways, and we don't need to stop here. Medicine's progressed too much to do that. And hormones is a great way to start. If you don't know where to start and you just know things are off and you're not sure what to do, that's probably where you need to go. And so let us help you. Book a consult with us. Testosterone is a scheduled substance, so doing anything outside of the state that we are licensed in is not something that we can do, but we are actually building up new protocols and packages for hormone replacement therapy, where home delivery may be an option and things like that. I cannot wait for that to come out and y'all to hear more about that, but please, this is just meant for more of an information sesh and just the importance of hormones in a woman's life and utilizing what that can be. Now, that doesn't mean you men are left out. Men obviously benefit from hormones as well. Testosterone replacement therapy, not steroids, not anabolic steroids, but testosterone, true bioidentical testosterone, super important as well, and for many other factors. And I bet you didn't know this either. Testosterone, if we increase that, actually naturally, some of that will convert and make you more estrogen as well, without necessarily replacing the estrogen. So many benefits and so many things to talk about. I would keep going if I could, but ultimately I got to sign off. So thank you so much for listening. Once again, Alexa here with NP to Go. Please let us help you utilize and optimize your hormones.